Welcome to a Prevent Connect podcast, where we explore the prevention of violence against women. This is a project of the California Coalition Against Sexual Assault.
Welcome everyone, my name is Ashley Klein-Jimenez and I am with Prevent Connect and CalCASA. And you're joining us today for our web conference titled Addressing Access to Alcohol and Alcohol Environments for Sexual and Domestic Violence Prevention. Prevent Connect is a national project of the California Coalition Against Sexual Assault sponsored by the U.S. Centers for Disease Control and Prevention. The views and information provided in this web conference do not necessarily represent the official views of the U.S. government, CDC, or CalCASA. So I would like to turn this show over to my partners at Prevention Institute. And Alicia, I'd love to just introduce you. Alicia Somji has been facilitating these web conferences this year, and I'm so excited, Alicia, to have this conversation. So I'm going to give you the podium.
Thanks, Ashley. Hi, everyone. This is Alicia, and with me here today I have Katrina, who is helping web tech. She's a program assistant at Prevention Institute.
Hi, everyone.
So we're really excited for this session, as we always are. We're really enjoying exploring a diverse range of issues that are relevant for sexual and domestic violence prevention. And as you know, today we're talking about alcohol. So we're going to go through identifying research on the connections between alcohol outlet density and sexual and domestic violence prevention. Our guests are going to share some real-world examples of how they're modifying both physical and social aspects of alcohol environments. Our first guest, Elise Lopez, is looking at alcohol outlet density in Arizona and working with bars, while Jorge Castillo, who is our second guest, is focused on a range of social and health issues as they apply to alcohol and alcohol justice. And Jorge works at an organization called Alcohol Justice that's focused on grassroots organizing to really prevent alcohol access. And then we want to engage in a candid discussion with all of you. As you've noticed, we have this text chatting feature, and we really want to make use of it. There's 180 of you participating right now, and we want to have a very engaged text chat. So please share any thoughts, questions, comments. We'll engage you throughout with different questions, and so we're looking forward to a good conversation. And so with regard to this last objective, that's all about candid discussion on the complex relationship between alcohol and violence. We want to start off our session today with a text chat question. So we want to ask all of you, what questions or concerns arise for you regarding the relationships between alcohol and violence? How do you frame this relationship? And the reason we're asking this is because in 2015, we had a Prevent Connect web conference on the role of alcohol policies for intimate partner violence and sexual violence perpetration prevention. And during the interactive portions of the web conference, the audience engaged in a dialogue on how there is a relationship between alcohol and sexual and domestic violence, but a need to understand that a correlation doesn't mean that alcohol causes violence. So we're really hoping that you can engage in this this question with us so we can kind of dig deeper into it. So alcohol, we heard on that web conference, it's sometimes used as an excuse, which can minimize the abuse. It's also been used to discredit or blame those who have been abused. But at the same time, we want to acknowledge the risk. And if something is correlated with violence, if you address it, you can decrease the likelihood of violence. So it really is complex. And we want to dig deeper into that. So while you're sharing some questions there and some thoughts, I thought that I could share Prevention Institute's 2 steps to prevention. So we want to use this to help frame our discussion about alcohol because we see this trajectory to really move upstream and help us look at why sexual and domestic violence is occurring. So moving beyond just looking at individual behaviors, we can see how community environments and structural drivers may influence outcomes. As part of the community environment, when it comes to domestic violence, we did some research and spoke with some practitioners in the domestic violence field, and we found 7 community-level factors that are associated with domestic violence, and they're outlined here. And for our conversation today, I think the one under place, which is all about alcohol outlet density, really relates to this and helps us talk about alcohol at a community level. And so the question I wanted to answer kind of here is, what is alcohol outlet density? I want to make sure we're kind of starting off on the same page. So it refers to the quantity and geographic distribution of establishments that sell and market alcoholic products within a specific geographic area. So communities are really trying to address alcohol outlet density, as well as thinking about other policies and actions, such as modifying drinking environments, thinking about time of sale, pricing, and that type of thing. So we have shared in the text chat, or we're about to share, 2 journal articles that are all about different alcohol-related policies. One is focused on sexual violence, and the other one on intimate partner violence prevention for you to also check out. I also want to mention, I know a lot of you have been focused on shared risk and protective factors based on the Connecting the Dots research that came out. And so I want to mention also that as we start moving upstream, we do see issues like alcohol outlet density related to other forms of violence too, such as child maltreatment, youth violence, and suicide, for example. So I would like to go back to our text chat and see what's coming up. It looks like there's been quite a bit of engagement here. So I see one question that was asked, how much is too much alcohol? It's a common question from young people. Ashley, what's coming up in the text chat?
Yeah, I think there was many comments about navigating conversations about consent when alcohol is involved, and I would guess that a lot of these conversations are happening with some of our folks from colleges and universities on the call. Also, you know, the difference between causation versus correlation when we're talking about alcohol. It sounds like people agree that this is a really important conversation, but how do we talk about it and frame it without kind of that slippery slope into victim blaming? And then there was a question, and I just lost it in my scroll, but it was around what kinds of environmental factors, increased risk factors, or protective factors with regard to social norms and drinking spaces. And I think that's some of what we'll get to today, I hope.
Yeah, that's great. And thank you all for sharing your comments and questions. I saw something about consent as well, consent and alcohol consumption. So I think that's interesting. Because you did mention kind of the other factors, so in addition to looking at alcohol outlet density, I just put it back on this slide here where we had done research on domestic violence, and some of the other factors that might relate to alcohol environments are definitely things such as looking at the norms that go along with that, and how harmful gender norms can be exhibited through things like media and marketing practices and things that maybe the alcohol industry puts out. I know we've seen some images in the past on Prevent Connect web conferences of beer companies or that kind of thing exploiting or sexualizing women in harmful ways. So I think that kind of all relates back to alcohol access and alcohol environment. So hopefully we'll be able to get into that a little bit more today. So I would like to introduce our first guest, who is Dr. Elise Lopez. Dr. Elise Lopez is a sexual violence researcher at the University of Arizona's College of Public Health. She focuses on environmental and policy-level prevention of sexual assault. One of her areas of expertise is reducing sexual aggression in bar settings. So this really gets to looking at the alcohol environments as well, and those norms that may be exhibited in them. So Elise, as someone who has extensively researched this topic, what are the connections between alcohol environments and violence, and specifically alcohol outlet density?
Hi, thanks everyone for having me here. That's such a big question to answer because there are so many ways of looking at it. So, we can look at the connections between individual risk factors for perpetration and victimization and what happens with those in bar environments and how they might be exacerbated. And then there's also things out in the larger sphere. So our social environments, what do our social environments condone or help people to turn a blind eye to? For example, a lot of sexually aggressive behavior that happens in bars is often shrugged off by patrons, by victims themselves, or by bar staff as being normal and acceptable flirting behavior. And then there's also the idea of alcohol outlet density, which you talked about just a few minutes ago. And so there's a lot of research that shows where you have a lot of bars crammed into one place. So, for example, a lot of downtown type areas or around colleges and university campuses, you also tend to have hotspots of police reports for violence. So there are lots of ways that alcohol and sexual and domestic violence are connected, and there are lots of ways that we can be looking at how do we change, for example, bar environments that might facilitate sexual aggression. So there's a huge literature on the connection between alcohol and sexual and domestic violence, and there's also a huge literature on what sexual aggression looks like specifically in drinking spaces. And so one of the things that I work on is bringing those two ideas together to figure out how do we actually do something about sexual aggression in bar environments so that it doesn't escalate to physical or sexual assault later on. And so what we know about sexual aggression in bar environments is laid out on this slide right here. There's a lot of literature behind it, and some of it is listed here. But we know that alcohol increases perpetration risk and victimization risk. It's not a cause of violence. Not every person who drinks will become violent or will be violently victimized every time they drink. But we know that it increases perpetration risk and victimization risk. In about 80% of rapes, either the victim or the perpetrator had consumed alcohol. And when you look at intimate partner violence or domestic violence, it's about 30% of the time there's alcohol involved. And there are a couple of different ways that alcohol and other drugs can be involved in sexual aggression situations and in sexual assault and in physical assault situations. And so one of the questions that comes up a lot and that I think also came up in the text chat was around if both people are drinking, who's at fault? Or did they rape each other, for example? How do we interact with that? And a lot of that tends to be answered by state statutes at your state level. But in most places, typically the way that's looked at is the person who, in the situation, either initiated or completed a sex act or is seen as the aggressor, tends to be the person who's looked at as the perpetrator in that situation under the law. So it really just depends on where you are for how that gets answered. But the other thing that comes up, and that also came up in the text chat, is if somebody is drinking or using other drugs, how does that change their role in an assault that happens? Is it partially their fault, for example? And so when we do research on victimization risk, we look at that in two ways. We look at what's called alcohol and other drug facilitated sexual assault, and that is when a person is deliberately given lots of alcohol or other drugs by a perpetrator who is deliberately trying to get them intoxicated in order to assault them. The other way we look at that is what we call incapacitated sexual assaults, and so those would be instances where the alcohol use or the drug use was self-induced. And so keep that in mind because it comes into play a little bit later on when I talk about intimate partner violence in bar settings. So why else might we want to look at bars? They are a highly sexualized context. Many people go to bars with their intimate partner or with groups of friends. They are dancing on top of each other. A lot of the times people may go to bars looking for a hookup for the night, which is perfectly fine, but they should always have a choice in who that hookup is, right? So it's a very sexualized context in most bars. Around college campuses particularly, we have a really high-risk population that is going to those bars. And often they're engaging in risky alcohol behaviors like binge drinking, potentially mixing other drugs with alcohol, and they're also just generally at a higher risk of sexual violence perpetration and victimization. And so this is something that we really need to think about around college and university campuses where we have a lot of bars typically located in one place. We have this high-risk population going to those bars and often bar hopping as well. So how do we deal with the fact that these are really kind of perfect storm environments for aggression? These places tend to be hotspots for police reports. So in some of the studies that I've done and that others have done, we've really seen that where you have a lot of alcohol serving establishments, you also see a lot of police reports for physical assaults and also for sexual assaults. And also in the last few years, CDC has really been pushing for a move beyond individual level interventions. So many of us are involved with doing education, whether it's around alcohol, sexual assault, intimate partner violence. We do a lot of education with communities, with students, which is great because we need to make sure that people are getting a change in their knowledge. But what we can also do is look at environments that facilitate sexual aggression and other types of aggression and figure out how do we change these environments so that they don't facilitate sexual aggression. So there's a lot there for us to work with, and bar environments are really a place that can be key for changing the environment, reducing aggression, and hopefully down the line reducing assaults as well.
Thanks, Elise. We have a question coming up in the text chat. I'm not sure if you have the answer, but I thought I'd just pose it to you to see. The question is, does the price of alcohol have a significant impact on consumption in the college environment?
Yes, so alcohol pricing policies in general has an impact on the amount that people drink, which in turn can certainly have an effect on their ability, for example, to read social cues, on their risk for victimization or perpetration of violence. So absolutely, it's all related. And so one of the things that we actually work with on bars is looking at their bar policies around pricing, especially around pricing that might hypersexualize women who tend to be at the greatest risk of victimization, or pricing policies that sort of increase the sexualized environment. So things like 25-cent shots for ladies, free cover nights for women on Friday nights, things like that. So yes, absolutely.
Right. Great. Well, I guess not great, but well, great that the policy can help limit that. But before we get more into the bar work, I'm wondering if you can share a little bit more about GIS mapping. You mentioned alcohol outlet density and hotspots. So really interested in what GIS mapping is and how practitioners might go about analyzing connections between sexual and domestic violence in their communities and liquor licenses. And how can this type of mapping be used?
Okay, sounds good. So let's get there. So GIS mapping, many of you may have heard of. It's basically an innovative approach that can be used to pinpoint where incidents are occurring. And when we know where incidents are occurring, we can then target our prevention efforts to problem areas. And then over time, we can also assess the success of those prevention efforts by doing more mapping. And so some of the ways we can get data for GIS mapping are things like
police data sets. We use data sets from departments of liquor license and control. So they have data sets that can tell you where all of the liquor licenses are in a community. And so some of the work that we've done around that has been to, over time, look at where reported rapes are occurring, where other types of violence are occurring, and then also comparing that to where we see liquor licenses. So, for example, these are some of the maps that the Arizona Department of Health Services, who's one of our main partners in the bar work in Arizona, did back in, I want to say 2011 or 2012. It was right before the federal definition of rape changed. And so the numbers here for rape are lower than what they would be today because a lot of types of rape were not being counted at that time. So in the larger map, the one that's titled Arizona Rape Risk, this one shows the rape risk color-coded throughout the state of Arizona. And this was calculated using rape data from police data sets throughout the state. And they also looked at 4 main cities in Arizona. They looked at Tucson, Phoenix, Tempe, which is adjacent to Phoenix, and then Flagstaff, which is in northern Arizona, and looked at the alcohol outlet density and also looked at where reported rapes were occurring. So the smaller maps that are on the right side of the screen are of Tempe, which is where the main campus of Arizona State University is located. And so on the bottom map where you can see the little numbers in all of the squares, those are in little census tract areas, and the numbers tell us how many alcohol outlet licenses there are in that little area. And there are also little dots with flags that show you where campuses are for colleges and universities. The map up on top shows you the same color coding of alcohol outlet density, but on top of it are little dots where sexual assault reports were made. And so you can kind of see there's some slight clustering in the middle area around here. That doesn't show up very well. And so you can kind of see where you're going to see a lot of assaults. So we actually redid all of this mapping last year with police data from all of 2016 in these same cities, and those will be published next month on a website called Map Dashboard in a white paper. So if you just Google Map Dashboard, you'll be able to find that website, and that paper will be coming out in about a month. And you can see some examples of updated maps that use color coding to shade where there's a really high density of alcohol serving establishments. And in 3 of the 4 cities, we actually found that where you had a lot of alcohol serving establishments, you had these really distinct clusters of physical and sexual assault reports. And we tended to see those around colleges and universities, around military bases, and near freeways, actually. So GIS mapping can be used in lots of different ways. You can do really basic things like color coding or counting where things are. You can also, if you have somebody on your team that's really good at GIS, do some more complex things like looking statistically at the relationship between alcohol outlet density and violence that's occurring.
Thanks. It sounds like I really like, oh yeah.
I think we can skip through it. Go ahead.
Oh, I was just going to say, yeah, GIS mapping is really interesting to me, and seeing how you can layer many different things. So I know, like, you're talking about layering alcohol outlets with violence, and I've seen it be used for even layering other, like, social determinants of health, and it can really help make that case for moving upstream and needing to change policies and that type of thing. So with that, I'd like to ask the audience on the next slide, how have you or could you use alcohol outlet density data and violence data for local action? So if you have used it before, would love to know how you're using it. If you haven't, what ideas do you have for using it? And also, if you're doing other things in this realm, we'd love to hear the work you're doing. So please do share in the text chat. And while you're typing, I'm going to ask another question to Elise. I understand that Arizona has been a leader in working with bars, and you've already mentioned some of the work. I'm wondering if you could expand on that a little.
Sure. So we have lots of different things going on. So we are working on the alcohol outlet density mapping, and then one of our larger initiatives is called the Arizona Safer Bars Alliance. And with the Arizona Safer Bars Alliance, we have a partnership between the University of Arizona, the Department of Health Services, and then various agencies throughout the state that are funded to do prevention activities through the CDC's Rape Prevention Education funding. And then bars throughout the state partner with us as well on this. So it really is a statewide initiative that's going in 4 cities right now. And the central part of it is a multi-session curriculum that we have developed in Arizona and is currently being evaluated. That is a training curriculum. It's a bar bystander training curriculum for people who work in bars. And so it is an individual education program, but we also work with them on risk assessment, which I'll talk more about in a moment. But I wanted to briefly talk about why we might need bar-specific bystander programming. Many of us either work with bystander education or we know about bystander education. It's used a lot right now in colleges, and also we're starting to see a lot more bystander in high school and middle school start to pop up. And oftentimes we might think, well, we can take what we know about regular bystander education programs and transpose it into a bar environment. And to some extent, that does work, but there are other things that we need to consider about bar environments that change how we approach bystander interventions. So, for example, with a lot of bar staff, they have cognitive tension between what's a crime versus what's not a crime. And many bar staff are looking for things that rise to the level of a crime and then will call law enforcement to come to intervene. And so oftentimes they're not necessarily looking for signs of sexual aggression that later can rise to the level of an assault. And so we have to really build that into the training that, you know what we're trying to do is recognize sexual aggression before it gets out of hand and becomes a crime in your community. And so how do we recognize sexual aggression early on and be able to intervene safely and effectively to reduce that? We also have really unique liability concerns that when we're doing bystander education on, say, a college campus, the people that we're working with, like students, may not be concerned about. In bars, they have, in most states, some liability for patron safety. And in some states, that extends beyond the bar environment. And so if something happens involving the safety of patrons after they leave the bar environment, and that can be traced back to, let's say, over-service of alcohol at the bar can be held liable for that. We most often see that happening in drunk driving cases where there's involuntary manslaughter, but those statutes tend to be so broad that they really can apply to any kind of violent situation, including sexual assault or intimate partner violence. So they're thinking about those things. They're also thinking about, what if I intervene in my bar and it escalates? Could I or somebody else around us get injured? So there are these really unique liability type concerns that involve them, that involve other patrons, and that also involve their legal liability and their liquor license. They also have a different motivation for helping. So even though in many bars they do have regulars, patrons are not their friends. And often when we're doing bystander education with students, we're really trying to build that empathy that, you know, if you see something that's about to happen to your friend, or if you have a friend who is becoming aggressive and you fear they might hurt somebody, you should step in and intervene. With bar staff, that's not really the main driver for intervening. And as much as we want bar staff and everyone to intervene because it's the right thing to do, and they should do it out of the goodness of their hearts, that's not always where people are. And so we need to also consider what are their other motivations for helping. We also have to recognize that there are unique opportunities and barriers for intervention for bar staff. So, for example, social capital, when we're talking about bystander in other areas, is really important. We want people to intervene and feel good about it, and we want them to feel good when other people intervene as well. That can sometimes be a barrier too, because people might think that if they intervene, they're going to be seen as, killing a vibe in a party, or they're going to be seen as dumb, or they're going to be embarrassed. And so social capital definitely is an issue, but with bar staff, we often might be also dealing with things like actual capital. Many bar staff in many communities rely on tips. They don't rely on their wages to pay their bills. And so if they feel like intervening might cost them tips for the night, they're not going to do it. So we need to think about those types, and that's just one example, those types of things that come up for bar staff that really change how they're going to react to bystander education.
Right.
And
bystander,
go ahead.
Sorry, I was just going to say, and bystander education often is more of an intervention, secondary prevention type of level, but I think that this also really helps change the culture in bar environments and helps shift those norms away, creating a culture where sexual violence and sexual aggression is looked at as a community level issue. We did want to share some of the things that are coming out of the text chat, because there's been some great engagement on how people could or have been using GIS and some recommendations. Megan Moore shared that those who are not familiar with mapping software or don't have access to it, Megan shared that their agency uses Google Maps to map local nightlife districts. And it's a free and easy, user-friendly way to look at this type of thing. We also heard from someone in Scotland about how they just had a report that came out that shows that neighborhoods in Scotland with the most alcohol outlets had 4 times the crime rates than neighborhoods with the least. And they're using this information for the development of local alcohol licensing policies. Local licensing boards have the power to cap the number of outlets in particular areas. So that's neat. We also heard from a rural example how Bethel is very rural and only has 1 liquor store for a population of 6,000, and how there's been an increase in violence generally since the liquor store opened. So it looks like a lot of people are thinking about this. We had another comment on how Rachel mentioned that we're using it for lobbying the local council who controls liquor licenses. So sounds like there's some great work happening.
Yes, absolutely.
Yeah, so I thought you could now share maybe a little bit about some of the actions bars have been taking to modify their environments and practices.
Yeah, absolutely. So again, there are a lot of really specific considerations for bar environments. So we talked a little bit about social norms, but there's also peer support barriers. So if bar staff feel like their peers that work with them or their management is going to frown upon them for intervening or for standing up for somebody who's in an aggressive situation, then they're not going to intervene. The peer support we've found in our research has been really critical to work with. And we also have been working with bars to do environmental and policy and procedure risk assessments. So that really kind of adds layers to what they're looking at to prevent sexual assault and intimate partner violence from happening in their bar setting or even after people leave. The really cool thing about working at the environmental and policy levels is that we can influence people's behavior without them necessarily having to buy into the issue, right? So all of us stop at a red light when we see it when we're driving? I mean, I'm just going to guess that we all do. I hope that we all do. And we're conditioned to do that. We're conditioned to know that when you see a red light, you stop your vehicle. And that keeps many people safe every day. And we don't really think about it, right? We all believe that everybody should be safe on the roads. But we've set up this system of making it harder for people to get away with just driving willy-nilly and not stopping for others, right? And so we can change environments to facilitate behavior that we want and to make it harder to engage in behavior that we don't want. We do it all over the place. Traffic laws are one place. We do it in hospitals to increase physician hand washing. There are lots of ways that we use that. It's called situational prevention. And so we work with bar staff to look at their physical environment. So are there dim hallways or hallways with closed doors where patrons can go and can't be seen? Is it really loud and dark in the bar? And if it is, and that's part of their ambiance, how do they find other ways to increase visibility? So, for example, we have one bar that we're working with that is really dim. It's really loud. They have a lot of live music and flashing lights and things like that. So one of the things that they've done is they've strategically now placed mirrors in places where they don't typically have staffing so that they can look at those mirrors from across the bar and be able to see what's going on in areas where they don't necessarily have a staff member stationed. So there are lots of small things like that they've been able to do environmentally. We also have them look at their policies and procedures. So really looking at those things like alcohol, drink naming, looking at pricing policies, and also looking at their procedures, like training procedures for new staff. So they may be training new staff on how to prevent drunk driving, but are they giving any training to new staff about how to watch out for and prevent aggression by bar patrons? So those are some of the things we're looking at those environmental and social levels in the bar.
Thanks, Elise. Because of time, I'm just going to move over to the question of what are some other actions that communities can take in this realm?
You know, there are quite a few things that they can do. So is it okay if I just move forward on these slides?
Yeah.
Okay. So using data that already exists. So one person in the text chat did talk about using Google Maps. Those are out there and available for mapping where you have lots of alcohol outlets. Many police departments, if you're in a large American city, do have an interactive crime map associated with their website. So if you Google, say, interactive crime map of Phoenix, for example, you can actually find that they update overnight all of the crime that was reported in the past day. And so you can actually use those for many police departments to look at crime that happened in the last 24 hours, the last week, the last month, the last 6 months in many cases. And just having that alone and even filtering it by different types of crime, you can create these visuals that you can use for talking to community members, for talking to policymakers, bar managers who you want to work with. Having that kind of visual from things like Google Maps, from police data sets, or if you have access to a GIS person in your agency or in partnership, doing that can be very helpful. Definitely consider training alcohol serving establishments. They're a place where many people in the community go, and they're also, as we've shown, really robustly associated with violence. So it's really a prime place for us to have a huge impact that can potentially be community-wide. And of course, if you're in a community that also has a college campus, thinking about how campus alcohol policies might influence student off-campus drinking, or also thinking about how can we partner folks who are working on campuses doing prevention with folks who are doing prevention in the communities around these alcohol issues. It really can become a win-win situation when we have folks working together, especially when in both areas we're dealing with that high-risk student population.
Thank you, Elise. So we're going to bring Elise back at the end for more of a discussion, but we'd now like to move over to introducing Jorge. Jorge, are you there?
Yes, I'm right here.
Great. Jorge focuses on local, state, and national coalition organizing, training of leadership, press-worthy activities, and empowerment of local organizations. He promotes the environmental prevention model and its practical application in campaigns and policy outcomes. Jorge received his bachelor's from University of Iowa in political science and Latin American studies and his master's degree from UCLA in Latin American studies. So I'm really excited to have Jorge here from Alcohol Justice because it's nice to have someone who's working outside of the sexual and domestic violence field in an area that's still related and sees violence kind of coming up as an issue within his work. So Jorge, I know your organization isn't typically in spaces solely focused on sexual and domestic violence. So can you please start off by sharing what Alcohol Justice does?
First, I want to thank the Prevention Institute and specifically Ashley and Alicia for inviting us to talk and for your guidance in the process. At Alcohol Justice, we promote evidence-based public health policies. We're an advocacy agency that organizes with diverse communities and groups to pass laws that regulate the production, distribution, and sales of alcohol. We view our work as part of the social justice movement because working class communities and communities of color suffer disproportionately in health effects, violence, and crime related to alcohol. I just want to make it clear that we don't focus on individual behaviors associated with alcohol. We focus on the corporate side of alcohol. It is important to share with all of you that the alcohol industry today is run by 3 international global corporations based out of Belgium and England, and they are responsible for 80% of the alcohol sales that you see at retail stores, bars, and restaurants. And these corporations, which are similar to tobacco corporations and oil corporations, are only interested in increasing alcohol sales and profits. They focus their efforts into deregulating local and state laws to create legal loopholes so they can saturate our communities and colleges with alcohol sales.
This is really interesting. Can you share more on why you're focused on alcohol through a public health and social justice lens?
Sure. I want to briefly go over the corporate slide so people can see which ones of the corporations are. Sorry, I forgot to click forward. Of course, the research in the field of prevention tells us that areas that have an overconcentration of alcohol outlets have more incidents of violence. In 2008, we published a study that looked into the costs and harms associated with alcohol in California, and they were broken up into 4 parts: illness, crime, injury, and traffic. And we found that in California, the local and state governments spend $13.7 billion a year addressing alcohol-related harms, from judicial costs, emergency costs, hospital care, policing, and other associated situations. And across the nation, that cost is estimated at $249 billion. In relationship with this talk, we can see on the slide that according to our study, in California, alcohol is the leading contributing factor in 20% of assaults, rapes, and homicides. And if you include child abuse, you're looking at 8%. And the CDC tracks the cost and health effects of alcohol in all 50 states. You can go to the website listed on this slide that I have here posted to get the data related to your location.
Thanks, Jorge. So I know you did mention actions of big alcohol earlier on, and so I did want to pose a text chat question to everyone here. How might the actions of big alcohol affect sexual and domestic violence? So I want to get you thinking about that. If you have any examples that you've seen, it would be great for you to share that in the text chat. So for example, something that comes to mind that I mentioned earlier, things like the media and marketing practices of the alcohol industry, and how sometimes there's, hypersexualization of women specifically. So would love to hear more from you in the text chat about how you might think that the actions of big alcohol affect sexual and domestic violence. And Jorge, now that you've shared a little bit about the public health approach and how alcohol relates to health outcomes, I'm wondering if you could share a little bit more about the connections between alcohol and violence, and specifically sexual and domestic violence.
Yeah, the following data on the slides, the upcoming slides, is from the Bureau of Justice Statistics, and it relates to incidents where alcohol was involved. So when people drink and violence happens, we see that 59% of the victims are women and 40% are men. And when people drink and violence happens, we see that 47% of the incidents known to law enforcement happen between domestic relationships. So the victims happen to be mostly spouses or dating partners. 12% are family members, and 28% are acquaintances. Only a smaller number, 11%, are strangers. Now, when people drink and violence happens, what we see is that 66% of those incidents occur at a residence or a home, and 10% occur at bars or nightclubs. Now, 10% may seem like a small number, but it's not, because we're talking about millions of incidents nationwide. And we also see that 70% of the incidents are aggravated assaults and 68 are simple assaults. This is an interesting statistic. When people drink and violence happens, 77% of the incidents occur between 6 p.m. and 6 a.m., and only 7% of the incidents involved another drug. So what we're thinking is that possibly people come home, start drinking alcohol after work, or they go out for drinks and come back home, and then incidents occur at home, because the majority of those incidents happen in a residence or a home. And the story that narrated by the statistics tells us that when people get drunk and violence happens, the majority of the victims are women. 59% of the time the victims are a spouse, a family member, a dating partner, and the majority of the incidents happen at home between 6 p.m. and 6 a.m. And in the opinion of Alcohol Justice, based on these statistics, the majority of the alcohol-related violence is, for the most part, domestic violence, because it takes place at home and with family. And here at Alcohol Justice, we were completely surprised to find this out when we looked at the numbers. It basically says that alcohol-related violence impacts the family unit more than any other group.
Thank you, Jorge. We're going to go back to the text chat. Ashley, anything to report out?
So there's a lot going on in the text chat, lots of things being shared, but there was, Nicola posted a link talking about marketing practices, and a link to a poster for a bar that was seen on, I believe it's in Ireland, on Twitter. I haven't looked at that yet, so I have to do that. But let's see. I think that's yeah, go ahead, Alicia.
Sorry, I was going to say, I also see people talking about, conversation on what we can learn from going against the tobacco industry, and definitely a lot of conversation about media and marketing practices and how that influences violence and violent outcomes. So, Jorge, I know that you've also been doing a lot of work in terms of action. You've kind of framed the problem for us. So I'm wondering if you could share the example of your Los Angeles-based work.
Like I mentioned earlier, the research in the field of prevention tells us that areas that have an overconcentration of alcohol retail outlets have more incidents of violence. And Alcohol Justice is a member of the Los Angeles Drug and Alcohol Policy Alliance. And the alliance is organizing with the support of Councilmember David Rue to pass a city ordinance that will create something that we're calling alcohol restricted use subdistricts. And I will refer to it as ARUS from now on. And ARUS is a planning and land use tool that will place a limit in the number of alcohol licenses granted in selected neighborhoods in the city of Los Angeles. Los Angeles communities will be able to petition for an ARUS zone if they have alcohol outlet overconcentration, a high crime rate, or if community members want to protect sensitive areas around parks and schools. And if we look at statistics in Los Angeles per council district, because Los Angeles has 15 council districts and over 6 million people, some of the districts have over 500 bars and restaurants. And then on top of that, they might have another 200 liquor stores. So we're seeing districts with over 700 alcohol outlets. And some of these areas have high crime rates, and especially the ones around liquor establishments. And we hope that the ARUS zones will encourage healthier retail options to open up in place of liquor stores, because if you put a limit, a cap on the number of licenses that can come into a community, then you'll encourage other businesses to come in their place, especially if the area is safer and healthier. And what is great about alcohol restricted use subdistricts is that they can be small, like a few square blocks, or extend to a few miles. And we believe that the ARUS zones, the alcohol restricted use subdistricts, will allow for communities, law enforcement, public policymakers, and others to work together to protect communities.
I really like how it helps give power to community. And we also did share the report in the text chat on LA's alcohol outlet density, which shows that Los Angeles communities and cities with higher alcohol outlet density were more likely to have high rates of violent crime, alcohol-related emergency department visits, alcohol-related hospitalizations, and that's even after accounting for economic hardship. So in addition to the alcohol restricted subdistricts, what other policies can help, can people do, to really decrease alcohol outlet density or take on this issue? And how can sexual and domestic violence practitioners and advocates support efforts like these?
Yeah, we encourage people to form diverse coalitions, invite people to your groups that are not necessarily solely in the prevention or treatment field. Bring in hospitals, labor unions, churches, other social justice groups, gun violence groups, people who want to create bike lanes in the community, healthier stores, bring them all together, because the alcohol impacts communities at large. And we encourage, the main things that we encourage that you do is to do advocacy, change the local laws so you limit alcohol outlet density, because that is correlated to violence. You can raise alcohol taxes at the local or state level, because that's a proven way to lower consumption, especially by young people under the age of 21, just similar to the tobacco fees and taxes that you see placed that make it harder for young people to buy tobacco and access tobacco. We encourage that you pass policies and put conditions on local retailers as liquor stores so they don't allow the sale of single containers, because that has also been linked to increase in violence. The sale of single cans, malt liquor, Aqua Pops, Four Locos, those are attributed to violence incidents and nuisance. And another one we recommend is that you look to see if your local state government would be interested in lowering the driving blood alcohol content to 0.05, because a lot of the European countries and other countries across the globe have lowered the level in order to reduce the incidence of injury and traffic accidents and also to save lives.
So for the field of sexual and domestic violence prevention and the practitioners and advocates here today, how can they support efforts like these?
Well, like I mentioned, get involved in policy making. You know, you need to change policies. You know, locally, like I mentioned. You know, when I say form coalition, you need to involve them as well, because you can educate people as much as you want. You can talk about the problems as much as you want, but if your environment is flooded with alcohol, it's still going to happen. You know, I worked as a youth counselor in San Francisco in the Mission District, and I counseled some youth that had alcohol-related problems and problems at home. And then years later, I was counseling their younger brother or sister with the same problems because the community didn't change. The liquor stores were there, the violence was there, the poverty was there. So I would encourage anyone in the field to do policy change, because that way you will at least limit some of the incidents, and then you'll be able to tackle some of the other problems and put a cap on the amount of incidents that might happen related to alcohol outlet density.
Thank you, Jorge. Elise, I see you've been quite active in answering people's questions on the text chat, so really appreciate that. Wondering if you could maybe share some of the things that you've been putting in the text chat for those who may not be on the iLink platform and may just be listening orally.
Sure. So we're having some conversations about tobacco, the tobacco reduction successes in public health, and how we might translate that over into sexual violence prevention. And I think that the successes we had with reducing smoking and other tobacco use and preventing youth from beginning to smoke or use other tobacco products was really huge. And there are lots of areas where we could take a note from those successes. So, for example, the tobacco reduction policies and use policies, increases in excise taxes, changing product placement even. So all of that had a huge impact on people being able to use tobacco in public places, being able to access tobacco, reduced youth access to tobacco, and the saturation of community messaging around this topic really increased people's conversations about tobacco in their social circles. It changed the social culture around smoking so that eventually people who smoked were seen as less cool, or smoking was seen as less normative. We had children who were asking their parents, why are you smoking? Don't you know that causes lung cancer? And all of that stuff wasn't happening before. So really when we start to talk about things like alcohol excise taxes or changing pricing policies, changing alcohol outlet density in terms of liquor licensing, all of that may sound new, but really it's been done before and done successfully. One of the challenges, I think, though, is around how do we do community messaging that ends up having the same effect, because tobacco is unilaterally bad for people, and there's so much evidence about its harmful physical effects on people that we do scientifically at this point see tobacco as a cause of things like lung cancer, whereas with alcohol, it is very strongly correlated with violence, but not every use of alcohol is going to cause a violent event. So how do we have similar conversations while also acknowledging that, I think is still a hurdle for us in this area. So that's one of the big places where we're having a conversation.
No, this is a really interesting conversation and really gets to the complexities of the differences between correlation and causation. Jorge, it seems like your suggestion of bringing together different advocates who are working on different issues to combat the problem is really resonating with the audience here. And so I'm wondering if maybe you could share who some of the partners in the LA work are, just so that it gets people thinking of the types of other groups that they may need to be thinking about if they want to take on things like alcohol policies.
Sure, we have folks from labor unions that are supporting us, Women Against Gun Violence, folks that are working in treatment, prevention, advocates that want to create healthier food options, advocates that want to create gardens in community neighborhoods, advocates that want to protect tenants, from increasing rent prices, gentrification. So we work with a broad array of folks, people that want to lower sugar tax, they want to increase sugar taxes and limit junk food in corner stores. So we're willing to work with anybody that is willing to support us. If you want to create a bike lane, we'll help you, but help us, make the community healthier by limiting alcohol over concentration. All these are related because the liquor store sells junk food and a lot of sugar, right? Gun violence is associated with alcohol. Cancer is associated with alcohol. Cardiovascular disease. So anyone who's working within diabetes field, we'll work with you. You work with us, so we can support each other in our work because it is interconnected. The industry, the tobacco companies, the oil companies, the alcohol companies, they work together to pass laws to deregulate, to lower taxes, to make it harder to pass taxes. So they're already combining their work to assure their profits. We need to do the same. We work with folks that were protesting the Keystone Pipeline because they were also protesting alcohol at the same time up in South Dakota. So the alliances need to be created, and we need to stop thinking in silos and start trying to connect each other's strengths and work together because we see this as a social justice issue.
Great. This really seems to be resonating with everyone here, and I think feels more doable when we think about the different partners that we can be engaging. And I like how you're framing it as thinking about the other things that go along with alcohol outlets, and also what when there are increased concentration of alcohol outlets in a community, what is being given up or what isn't being put in communities. So how you mentioned groups like those wanting to create community gardens and healthy food options, and thinking about when certain places of business are in communities, what's not there. And I think this really connects to our text chat question that we want to ask the audience and our guests today on our next slide, which is how do you approach this work without reinforcing stereotypes about communities of color and low-income communities? So, Elise, would you like to start off with your take on this question, or how it maybe has come up in your work?
Sure. Yeah, I think that it comes up in two ways for us. The first way is how we actually put our program out there to communities. And our program really is open to any bar in Arizona that wants this training. So we really focus on broadly disseminating information about the program rather than focusing just on certain areas in the community that seem low income or that are typically communities of color, and reinforcing those stereotypes. We really actually tend to saturate it around college campuses because that's really been the low-hanging fruit for us. So it sort of has naturally happened that way. The other way that that comes up for us as an issue is actually in bar settings. And so one of the things that we've had to work on over the last year is being able to add more content into the training about implicit bias. That was not something that was part of the original training that was created 7 years ago. And so over time we've added that not only to talk about things like how the way patrons are dressed might consciously or unconsciously affect the way that they view those patrons or their willingness to help them if they're if somebody's being aggressive toward them, but also starting to have those conversations with people about implicit biases as they relate to things like race, ethnicity, socioeconomic status of patrons, because it really does come up. So being willing to even have those conversations is one thing, and then training our facilitators in those issues and then having that ripple effect out into our trainings has been very important.
Mm-hmm. And Jorge, how's it coming up for you in your work?
Well, like I mentioned earlier, limiting alcohol outlet overconcentration is a social justice issue for us. And working class and communities of color, where you see the clusters of overconcentration, have been historically marginalized, economically and racially segregated, and politically excluded. And that's one of the reasons why you see the alcohol overconcentrations in these areas. And the alcohol industry, from the producers to the distributors to the liquor store owners, exploit these conditions to their advantage. So a community that has no political voice cannot stop an alcohol license. Even though it might seem, well, what's the big deal? Why can't you stop a license? You'll be surprised the political maneuvering that takes place for one alcohol license. And it's also very difficult to stop and close problem alcohol establishments. It could take 5 years on average to close one down, and usually they just sell their license to a family member and they start fresh, but the problems continue. And anyone who has tried before can attest to it. And so we encourage people to engage in public health activism and even utilize nonviolent direct action if necessary in order to protect your community. And that is how you overcome stereotypes and empower your community.
Thank you. This has been a really interesting conversation and a very active text chat, so I really appreciate all the engagement that's going on. Ashley, anything you'd like to pull out here from the text chat?
Yeah, I think, as Elise had mentioned, just like being mindful of this potential and being willing to have the discussion is something that I'm seeing. As I talk, there's more coming in. But I think, some people are still struggling, like how to work these conversations into work that they may already be doing with bars. And so I see some instances of like role playing when it's different types of people. But I think this is probably a question that we have to continue to be mindful of as we look at how we're going to impact our environments. And I think I really like what Jorge said about the historical context of how these environments are often created.
Great. So we don't have too much time left, and I want to make sure we get to our key takeaways. So I'd like to ask our guests, what tips do you have for those working in sexual and domestic violence who are interested in reducing access to alcohol and modifying alcohol environments in their communities? So Elise, maybe we can start with you.
Sure. Well, we already talked about using existing data sets like police reports of violence for GIS mapping. We would also add in engaging bars in risk assessment, considering their physical environment and bar policies. So if you are working with bars in your community, it can definitely be a struggle sometimes to even get them to engage in training simply about the issue of sexual violence. But really being able to extend that into talking about their environment and how that affects patron behavior can be really important in actually shifting patron behavior, in actually changing the physical environment. Because bar staff, realistically, even with bystander training, can only intervene so much. And so if we can even prevent aggression from happening in bars by changing things like alcohol pricing policies or changing the physical environment attributes, that's going to be a huge win. finding creative ways to incentivize bars has been really important for us. The Arizona Safer Bars Alliance was one of the pioneering projects in this field of bar bystander intervention. And over the years, we really struggled with the idea of how do we get people involved. And so we have definitely had to do things like talking about the relationship between our state statutes and patron safety around sexual violence. That connection had never been made in the minds of a lot of our bar owners. We have the trainings at the bars. We have a lot of freebies associated with the program. We have done a lot of smaller focus groups with community members and college students around their perceptions of bars that are trained, and so being able to use the community voice to say, we want to go to these types of bars, really gets bars wanting to do the training because they see that as a financial incentive. So if they get trained, people want to go to a bar that has their back, then people are going to spend more money there. So those kind of creative ways have been really helpful for us. And I would recommend that you look at those things too.
Yeah, I think earlier on there was a question in the text chat of like what's in it for the bars, and so I feel like that last tip there really got to that. And what you were saying around risk assessment and considering the physical environment and bar policies made me kind of think beyond bar settings and work that people might be doing in bystander intervention in other areas, and how maybe they could consider physical environments in those areas too. So for example, I know in schools there's a shifting boundaries curriculum and work where getting students to map out safety in their school environments too. So it feels like it kind of can apply even beyond.
Yeah, absolutely.
And Jorge, what would you like to share with the audience as your tips?
Well, you need to, just folks need to keep in mind that most people relate to alcohol on a personal basis. They bought the lingo from the industry that you can drink responsibly and be drunk and be responsible. But there's a mechanism at work that is producing alcohol in large, massive quantities through a production assembly line, and they're being shipped all over communities. Across the country. They're being shipped to all the bars next to college students. I went to the University of Iowa, and from Thursday to Saturday, it was drink as much as you can, and they're hijacking our communities. And we have the right ourselves to protect our communities, to protect our families, just as much as they have the right to sell their products. So there has to be a balance, and I encourage people to become advocates. I encourage people to change policy. I encourage people to become engaged, because otherwise, you're just going to be seeing all these consequences happening. And it is, although there is a personal struggle with alcohol, there also is a corporate side to it, and it's important to keep in mind.
Thank you. So before we leave for the day, we want to share some tools and resources. So I know there are some questions in the text chat about them. So just to summarize, we'll go to the next slide. So we do invite you to check out the Arizona Safer Bars Alliance website. Elise, are there, I think I saw reports and stuff on the work there. Is that correct?
Yes, so on that website there are project reports from earlier in the project. There are not any for the last couple years. Right now we're in a transition with the website and being able to start using safer bars in other states beyond Arizona. We actually just trained folks throughout the state of New York. So we're in transition website-wise, and a new website should be coming soon for the program out of the University of Arizona.
Great. And then Alcohol Justice's website has some great information on there that you can access. Anything you want to say about that, Jorge?
Yeah, just go visit our website and see what kind of projects we're working on, and you're welcome to contact us, and we can provide consulting support and advice on coalition building and advocacy. And for those college students out there, you have as much right in your college to not let it be hijacked by the industry. They organize sporting events, sponsor teams, and it's important to have a healthy college environment. Go visit our website and get more information.
Great. And on our next slide, we also want to share the CDC has a guide for measuring alcohol outlet density. So those of you who are interested in more of the technical end of things, that resource is available. And on our next slide, we also have links to the journal articles that we mentioned earlier on. I know there was a request to share PDFs of them, so we'll see if that's something that we can do as well. And so we'll go to our next slide. Just a reminder that we do have a report from our 2017 Prevent Connect series that includes summaries and descriptions of what kind of happened in our last year's web conferences, and we are going to be doing write-ups on this year with profiles on our specific guests, so stay tuned for that. With that, I think we had a really engaged audience and participant discussion today. I really enjoyed the liveness of it all, and really appreciated having both Elise and Jorge join us and be willing to answer questions, and Jorge for sharing perspectives outside of the sexual and domestic violence prevention field, Elise for offering expertise on the amazing work in Arizona. So thank you all for participating. I'm going to hand it over to Ashley to close us out for today.
Thanks, Alicia. Well, I want to thank our guests and all of you for all of the participation. It was such a great conversation and one that I think we could definitely continue. And so stay tuned. We'll have to return to this topic at some point for sure. I do just a couple announcements. You will receive a post-web conference evaluation survey in about 20 minutes. Once you complete that, there is a link for a certificate of attendance on the last page. So if you are looking for that, that is where you will find it. If you have any trouble accessing that for any reason, feel free to send me an email. I also wanted to just quickly let everyone know, if you have not heard, registration for the 2018 National Sexual Assault Conference has opened this week. I just put a link for you to learn more, but there is a lot of prevention-related workshops that will be offered, and the theme is Bold Moves, Ending Sexual Violence in One Generation. So even just the theme is really leading with prevention. Prevention Institute will have a mini track. So anyways, I hope you'll check that out and hope to see many of you there. This session was recorded, and so you will receive an email in the next couple of days with a link to that recording if you want to share that with anyone. And then we will also be making the text chat available in the next week or so. If there were some conversations that you wanted to go back to or resources that you wanted to find. So thank you all again for joining us, and we hope to see you on the next web conference at the end of this month on sexual health. And just really grateful for our partners at Prevention Institute for facilitating this conversation. And I think that should end us out for today. So I hope you all have a wonderful rest of your Wednesday. Thank you also to our international folks in the audience today. I can't even imagine what time it is where you all are joining us from. Thanks again, and we'll talk with you all later. This ends our session for today.
Thank you for listening to this Prevent Connect podcast. Prevent Connect is a project of the California Coalition Against Sexual Assault, with funding from the Centers for Disease Control and Prevention. The views presented on Prevent Connect are not necessarily the views of the United States government, the CDC, or CalCASA. To learn more about Prevent Connect, visit www.preventconnect.org. For more information about CalCASA's mission, or to show your support, visit calcasa.org. That's CALCASA.org.